This is a look at all of the reported COVID-19 cases in the state since the pandemic began. You can see at the end of this graph, we started to see another rapid rise in cases, and this data likely does not include at-home tests that can go unreported. As for reported tests, California now averages more than 43,000 new reported positive tests a day. The state's positivity rate now reaching more than 21%. Demand for testing is not slowing down. This is video of the California National Guard starting to help at testing sites across California. Governor Newsom just activated more than 200 CalGuard members across 50 Optum Serve sites in hopes of increasing capacity for walk-in appointments. Tomorrow, the governor is expected to announce more funding for the state's COVID-19 response when he releases his new budget proposal. He wants $2.7 billion to go toward the pandemic, with 1.4 of that to be earmarked as emergency funds to be used immediately. Meanwhile, as more and more people are calling out sick or isolating due to exposures or positive tests, changes are now in place for some California healthcare workers. If needed, healthcare workers may be told to go back to work without quarantining. It's causing outrage. New at 11, ABC 10's Van Tu is hearing from healthcare workers and the state.
Well, for the next month, hospitals in California facing staffing shortages can resort to a new rule set by the state that would require healthcare workers sick with COVID-19 to return to work. Healthcare labor unions say it opens the door for more infections for them and patients. Over the course of the pandemic, ultrasound technician Georgette Bradford has worked through labor shortages. And with an anticipated Omicron surge straining hospital resources, she's appalled at new state guidance to alleviate the pressure.
It's counterproductive, it's dangerous, and it's actually backwards to everything we're doing right now.
Temporary guidance from the California Department of Public Health states that healthcare workers who test positive or are exposed to COVID-19 may return to work immediately without quarantine or testing if they're asymptomatic.
We're in this industry to care for others. You know, that's the root word right there. And yet we are asking to put others at potential harm because of short staffing, which really is about dollars and cents.
State officials say the move allows flexibility for healthcare settings experiencing unprecedented staffing shortages. Fine print indicates asymptomatic COVID-19 positive workers should wear N95 respirators and only interact with COVID-19 positive patients to the extent possible. In a statement, officials say while vaccines continue to protect against serious illness, hospitals are reaching capacity and staffing shortages are making it difficult to treat those who need essential care.
I had to read it again because I thought this can't be happening. This can't be happening when we're anticipating a surge. We need to have more stringent protections, not less stringent protections.
The California Nurses Association decrying the move in a day of action Saturday. President Sandy Redding says the rule does more harm than good for both workers and patients. The labor union demanding the state rescind the guidance.
Then, of course, there's a shortage. There's not a shortage of nurses. There's a shortage of nurses that want to come in and work under those types of conditions. So if you're adding more dangerous protocols, that is not going to help the situation.
The temporary rule is in effect until February 1st, but CDPH says that a hospital must exhaust all of its options before mandating sick but asymptomatic employees back to work.
ABC 10 is reaching out to local hospitals to find out if they've had to bring back healthcare workers who are COVID positive. We've yet to hear from any local hospital that has had to use this rule.